This cream is used to relieve minor aches and pains in the muscles and joints, such as those caused by arthritis, backache, or sprains. The active ingredient, capsaicin, works by reducing a natural substance in the body that transmits pain signals to the brain. Apply a thin layer of the cream to the affected area up to 3 to 4 times a day, or as directed by your doctor. It is best to use this cream at regular intervals for the most benefit. When using Zostrix HP cream, remember to only apply it to the affected area on the skin and gently rub it in. It's important to avoid getting the medication in your eyes, mouth, nostrils, or genitals. If this happens, make sure to flush the area with plenty of water. Also, do not apply the cream to skin that is injured or irritated. It's best to avoid using this medication right before or after activities like bathing, swimming, sunbathing, or heavy exercise. Additionally, do not bandage or wrap the affected area or use a heating pad as it may increase the risk of side effects. After applying the cream, remember to wash your hands unless you are using it to treat your hands. If that's the case, wait at least 30 minutes before washing your hands. It's important to use this medication regularly at the same times each day to get the most benefit from it. Keep in mind that it may take up to 2 months for this medication to work. If your condition lasts for more than 7 days, gets worse, or keeps returning, make sure to consult your doctor. And if you think you may have a serious medical problem, seek medical help right away. When using Zostrix HP cream, you may experience warmth, stinging, or burning at the application site. If these effects persist or worsen, it's important to contact your doctor or pharmacist. Additionally, be cautious to avoid inhaling the dried residue from the medication, as it may cause coughing, sneezing, watery eyes, or throat irritation. If your doctor has prescribed this medication, it's because they believe that the benefits outweigh the risk of side effects. While many people using this medication do not experience serious side effects, it's important to stop using it and inform your doctor immediately if you experience blistering, swelling, or increased pain at the application site. In rare cases, a serious allergic reaction may occur, indicated by symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. If you notice any of these symptoms, seek medical help right away. Lastly, if you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist for further guidance. Remember, it's important to consult your healthcare professional for medical advice about side effects and report any side effects to the appropriate regulatory authority in your country. Before using Zostrix HP cream, make sure to inform your doctor or pharmacist if you have any allergies to capsaicin, zucapsaicin, hot peppers, lidocaine, or other local anesthetics. This cream may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. If you have any health problems, it's best to consult your doctor or pharmacist before using this medication. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are scheduled for an MRI test, let the testing personnel know if you are using the patch, as some patches may contain metals that can cause serious burns during the MRI. Ask your doctor for advice on whether you need to remove your patch before the test and how to properly apply a new one afterward. If you are pregnant, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so consult your doctor before breastfeeding. When using Zostrix HP cream, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's best to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. It's important to note that capsaicin, the active ingredient in Zostrix HP cream, is very similar to zucapsaicin. Therefore, it's recommended not to use medications containing zucapsaicin while using capsaicin. This is to ensure the effectiveness and safety of your treatment. Remember to always follow your doctor's guidance and recommendations when using Zostrix HP cream. If this medication is accidentally ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call their provincial poison control center. Make sure to keep all your medical and lab appointments to monitor your progress or check for any side effects. This will help your healthcare provider to make necessary adjustments to your treatment plan. If you happen to miss a dose of Zostrix HP cream, simply apply it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed dose and continue with your regular schedule. It's important not to apply a double dose to make up for the missed one. As always, if you have any concerns or questions about your dosage, be sure to consult with your healthcare provider. Make sure to check the storage information on the package before using Zostrix HP cream, and if you have any questions, ask your pharmacist. Keep all medications out of reach of children and pets. Do not dispose of Zostrix HP cream by flushing it down the toilet or pouring it into a drain unless instructed to do so. When the cream is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.